In people with sickle cell disease, their red blood cells become deformed, turning sickle-shaped. The bone marrow tries to make more red cells to make up for the loss, but can't keep up, causing anemia. Their new shape keeps them from moving properly through the body, and the misshapen cells can jam up and stick to the walls of the blood vessels. These clumps cut off oxygen to healthy tissue, delaying a child's normal growth and causing fatigue and extreme pain.
When the other kids used to go outside and play, I would try to do that. Then I'd come home and very sick and have to be back in the hospital.
17-year-old Alexandria Young of St. Louis, Missouri, has sickle cell anemia, among 72,000 Americans with the disease.
Among all Americans, approximately 1 in 1,500 to 1 in 2,000 newborns will be diagnosed with sickle cell disease.
In people with sickle cell disease, their red blood cells become deformed, turning sickle-shaped. The bone marrow tries to make more red cells to make up for the loss, but can't keep up, causing anemia. Their new shape keeps them from moving properly through the body, and the misshapen cells can jam up and stick to the walls of the blood vessels. These clumps cut off oxygen to healthy tissue, delaying a child's normal growth and causing fatigue and
Sickle cell disease is a blood disorder that is inherited from both parents. This disorder is more common in certain ethnic groups, such as African Americans, Arabs, Greeks, Italians, Latin, and Native Americans. Normal red blood cells are very flexible and are circular in shape, resembling a donut. Their flexibility and shape allow them to travel freely through small blood vessels called capillaries. In persons with sickle cell disease, the red blood cells become crescent or sickle-shaped and also become inflexible. The abnormal cells stick inside the capillaries, blocking blood flow to vital organs. Persons with sickle cell anemia can have symptoms such as yellow appearing eyes and skin, pale skin, delayed growth, bone and joint pain, increased risk for infections, development of leg ulcers, eye damage, anemia, and damage to the organs affected by the obstruction.
How is sickle cell disease treated?
The Aflac Cancer Center and Blood Disorder Service is committed to providing children with sickle cell disease a brighter future through advanced medical treatment, family-centered care, and innovative research. Patients are cared for by a multidisciplinary team that includes doctors, pediatric nurse practitioners, nurses, child life specialists, social workers, chaplains, school teachers, psychologists, and financial coordinators. People with sickle cell disease can lead long and productive lives with the help of treatment. Sickle cell disease may be treated with medication, hydration, oxygen therapy, blood transfusions, physical and occupational therapy, bone marrow or stem cell transplant, emotional and psychosocial support, counseling, educational services, support groups, coping skills.
Bone marrow transplant is not for everyone with sickle cell disease, although it is a cure. In terms of who is eligible for a bone marrow transplant, we generally reserve the procedure for kids who are about between the ages of 3 and 16 and who have established themselves as having severe disease, meaning they've had a stroke or they have frequent pain crises or they've had episodes of acute chest syndrome. Here at Children's, we have one of the largest pediatric blood and marrow transplant programs in the country. We typically transplant about 55 to 60 kids a year, and that's counting all diseases. For sickle cell disease, we're probably the largest center in the country in terms of numbers of sickle cell patients transplanted, and currently that's over 30 kids. We've done very well, and of the kids who've had matched sibling donors, all of them have engrafted, meaning the transplant has taken and the sickle cell disease has gone and not returned.